We all need sugar in our blood to provide cells with energy. The hormone insulin allows glucose in your bloodstream to enter your cells, where it can be used for energy. If you don't have enough insulin, sugar stays in the bloodstream. Over time, high blood sugar levels damage your blood vessels and can cause other problems such as coronary heart disease, kidney disease and diabetic eye disease. It's important to know whether you have high blood sugar so that this can be controlled, reducing the risk of damage. A high blood sugar level would mean you either have diabetes or have a high risk of developing type 2 diabetes. Although diabetes can have symptoms such as thirst, urinating a lot, blurred vision, weight loss, recurrent infections and tiredness, you may only get these mildly or not at all. That's why it's important to get tested. This video explains all about blood sugar tests to find out prediabetes, type 1, type 2, or gestational diabetes. These tests are simple and results are usually available quickly. If you are planning to test for type 1 diabetes, type 2 diabetes and prediabetes, your doctor will ask you take one or more of the following blood tests to confirm the diagnosis. Now let's understand these tests with this table. The A1C test measures your average blood sugar level over the past 2 or 3 months. An A1C below 5.7% is normal. Between 5.7 and 6.4% indicates you have prediabetes, and 6.5% or higher indicates you have diabetes. Fasting blood sugar test measures your blood sugar after an overnight fast of 8 to 10 hours. A fasting blood sugar level of 99 mg per deciliter or lower is normal. 100 to 125 mg per deciliter indicates you have prediabetes, and 126 mg per deciliter or higher indicates you have diabetes. Glucose tolerance test measures your blood sugar before and after you drink a liquid that contains glucose. You'll fast, not eat, overnight before the test, and have your blood drawn to determine your fasting blood sugar level. Then you'll drink the liquid and have your blood sugar level checked 1 hour, 2 hours, and possibly 3 hours afterward. The glucose tolerance test determines how quickly glucose is cleared from the blood. The test is used to test for insulin resistance, impaired beta cell function, reactive hypoglycemia, acromegaly, and other disorders of carbohydrate metabolism too. At 2 hours, a blood sugar level of 140 mg per deciliter or lower is considered normal. 140 to 199 mg per deciliter indicates you have prediabetes, and 200 mg per deciliter or higher indicates you have diabetes. Random blood sugar test measures your blood sugar at the time you're tested. You can take this test at any time of the day and don't need to fast first. A blood sugar level of 200 mg per deciliter or higher indicates you have diabetes. If your doctor thinks you have type 1 diabetes, your blood may also test for autoantibodies that are often present in type 1 diabetes, but not in type 2 diabetes. You may have your urine tested for ketones, which produced when your body burns fat for energy, also indicate type 1 diabetes instead of type 2 diabetes. During pregnancy, some women develop high blood sugar levels. This condition is known as gestational diabetes. If you develop gestational diabetes while you're pregnant, it doesn't mean that you had diabetes before your pregnancy or will have it afterward. But gestational diabetes does raise your risk of developing type 2 diabetes in the future. If poorly managed, it can also raise your child's risk of developing diabetes and increase the risk of complications for you and your baby during pregnancy and delivery. Gestational diabetes is diagnosed using blood tests. You'll probably be tested between 24 and 28 weeks of pregnancy. Blood sugar that's higher than normal early in your pregnancy may indicate you have type 1 or type 2 diabetes rather than gestational diabetes. Glucose screening test and glucose tolerance test are the two main types of tests which are done for gestational diabetes. The main difference between these two tests is that you need to fast for glucose tolerance test, and glucose screening test can be done at any time of the day. The normal result of glucose screening test is 140 mg per deciliter or lower. If your level is higher than 140 mg per deciliter, you'll need to take a glucose tolerance test. Depending on what type of diabetes you have, blood sugar monitoring, insulin, and oral medications may play a role in your treatment. Eating a healthy diet, maintaining a healthy weight and participating in regular activity also are important factors in managing diabetes.